5:03 by my time. We'll call the meeting to order. I want to take at least a roll call before we go through that. Well, before that, let me read the disclaimers. So participation via Zoom webinar only. Pursuant to Chapter 2 of the Acts of 2023, an act relative to extending certain COVID-19 measures adopted during the state of the emergency, signed into law on March 29, 2023, this meeting will be conducted via remote means and in person, as long as members of the public can easily access the proceedings in real time and participate remotely. Until further notice, this meeting will no longer be broadcast live, but it may be watched when the show is replayed on YouTube. This meeting is only virtually by joining the Zoom meeting with meeting ID 943-3378-7790 and passcode 014743. You may also send any comment or question to publichealth@plymouth-ma.gov. It will be entered into record and, as time permits, read and addressed by the Board of Health. Since I call it to order, I'd like to take a roll call. Dr. Reed?
Present.
Dr. Potvin? I don't believe he's there, so not present. Amy Palmer?
I'm here.
Thank you. Meg Payne? I don't believe so, so she's not present. Deb Zona?
Here.
Thank you. And Deb is our alternate Board of Health member. So she's with two members not present. She can vote if we have any measures that we'll be voting on, but we'll be primarily, this meeting is all about education, awareness, and some presentations that we're having. So next item on the agenda is the approval of the September 17 minutes. Has everyone had a chance or to look at that? I hope so. Can I get a motion to approve the minutes of September 17, 2025?
I so move.
Is there a second?
I was not at that meeting, so not sure I can second it.
No,
think
you
you can.
can't. Amy has to.
Okay.
Amy, are you there?
Sorry, guys. I'm trying to mute and unmute. Yeah, I second the motion for the minutes.
Okay. With a first from Dr. Reed, a second from Amy Palmer. Any discussion or any edits? Hearing none, we'll take a vote. Dr. Reed?
Yes.
Amy Palmer? Deb Zona?
Abstain, not at the meeting.
Okay. And myself, yes. So we have until Amy can.
Oh, sorry. I hit a dead spot. I know. I apologize because I had to work late and then I tried to get on the road.
Be careful.
Yes, be careful. Is your vote yay or nay on the? So that's a yes. Great. Thank you. Moving on. Chairperson's announcements. I want to first of all thank the principals of Plymouth High School North and South, Peter Parcelin and Patricia Fry. I think there's a great partnership, longstanding partnership with the Board of Health. I know in recent years that I've been a member of the Board of Health, there's been student representation from both high schools. It's been a symbiotic relationship. We get a lot out of it as a board because we get students and young persons' views on health matters that are significant to the town of Plymouth. And also they have a chance to see a board that's in action, and all the different wide spectrum of public health and health issues that come to the forefront, whether it's in the media or just in day-to-day public health operations that the public health division does. So I want to thank those administrators, as well as Mrs. Den, the science teacher. Our representatives this year are, and I'm not sure if they're, I know that Nora Kelsey is not able to come to the meeting today. She's from Plymouth High School South, but we have from Plymouth High School North, Madison Mack, as well, I believe, Charlie Walker from Plymouth High School South. So welcome, Madison. Just like to introduce you, and I know I asked a couple questions about why you wanted to be civically involved in with Plymouth Public Health, and what you hope to get out of the experience.
Yes, thank you so much for having me. I did this last year too for North, and I just really loved this experience. I felt like being one like single student in such a large town, like Plymouth has so many students, and just being able to like have a way where I feel like my voice was actually heard. It was just such like an amazing experience, and it was so valuable, and I just really appreciated all that I learned from everyone a part of it. And I just want to say thank you again for having me back.
Well, you're welcome. Thank you very much. I think it, like I mentioned earlier, we try and get use you as the point of contact. The kind of the an understanding of where your fellow students are thinking about and acting in different ways in public health. I'm going to open it up for, before I move on to Charlie. Are there any questions from the board? Dr. Reed, Deb, or Amy?
I have a question, Madison. If you could tell us a little bit about what you're possibly interested in doing. Now, I believe you're a senior this year,
Yeah.
correct?
Yeah.
So you'll have to be thinking about your future a little bit.
Mhm.
And what are you thinking at this time about that?
Right now, through the school's program, I do the co-op program. So instead of going to school every day, I go to school every other day, and I work as a CNA at Stafford Hill, the assisted living. And before that, I really had no idea. I always loved like science and medicine, so I was always interested in something along this lines. But then once I started working there, I truly like fell in love with just the idea of like helping these people and like bedside. So now I'm considering for all the colleges that I'm applying for nursing.
Wonderful. We can always use nurses.
Mhm.
And I have to tell you, I have a relative who is in a nursing home. She has Alzheimer's, and so she's in a nursing home. And the young people that work in that nursing home are just marvelous. I'm always in such awe of how kind they are to the older people, and it's just really wonderful. It's a good way to start your medical experience.
It's wonderful. Thank you, Dr. Reed. Any further comments from the other Board of Health members? Okay.
Is Charlie on? I don't see him on. Did you say Charlie was here?
I thought maybe the person on the Samsung,
Oh, okay.
but they did not have a name on there. So um, would the person joined as the Samsung SM-F9 on the Zoom just state your name, or hopefully you're in the right spot, because this is a Zoom meeting for the Plymouth Board of Health.
They don't want to. Okay.
Okay. Well, thank you, Madison, and I think you're going to be in for a nice meeting. We have quite a bit of updates and an agenda, something that was kind of giving a preview of the next agenda item, a presentation from the Plymouth Area Prevention Collaborative Coordinator, May Hickey, on Kratom. I hope I'm saying that right. But before we go on, I'm so sorry, May, but I did skip over public comment. And if anyone has public comment, please raise your digital hand. If you don't know where that is, it's on the lower bottom under React. And if you click the React, the heart button, there is a raise hand, and we'll call you upon you if you have any public comment. So I don't see any digital hands up, but I do want to add into public comment. We did receive 2 emails. One from Chad Perry, owner of the Vapeway. He's sent an email in the past before regarding some tobacco regulations, nicotine. And so he sent another email, and I just want to make sure that that's, and I sent that out, or Karen had sent that out to the board. Just want to make sure that that gets into the record. And then a second email from Paresh Patel out of 233 Sandwich Street. He also sent a letter, and the topic was around the nicotine pouches and tobacco regulations, which is one of our talking discussion points later in today's meeting. So with that bit of administratia put aside, and I see Paresh is on the Zoom, we'll continue on with the Plymouth Area Prevention Collaborative Coordinator, May Hickey, on your presentation on Kratom. Are you able to share a presentation, May?
A one-page flyer that I'm able to share, yeah.
Okay, well, we'll let you do that, and we'll let you walk through there. Maybe Dr. Reed, you could set the stage for us, because I know it was something that you brought up within the discussions and formulating this agenda, and you could set the stage, introduce, and May, you can give us an introduction of yourself as well. So Dr. Reed, please.
Yes, I met May at the Plymouth Area Prevention Collaborative meeting in September. And I am going to be giving a report on that meeting, which I'll be going to ongoing. I'm very impressed with the group. May gave this presentation about Kratom, and I learned so much about it. I thought that it was an important topic to at least start to make our friends and neighbors that may not know about it aware of it. I'm sure that the Madison could probably tell us, she probably knows about it from the teenage point of view, and we can ask her after we get our presentation. But this can be a problem. And so I thought it would be important for me to present this to us. So thank you for offering. And this handout, I think, is actually quite good. And I'm hoping that maybe we can post it. It's just one page, post it on our Plymouth website, the Board of Health website. So it's all yours, May.
Thank you. So hi everyone, my name is May. It's kind of, I go under a lot of different names for the organization. So the organization that I do my work under is High Point Treatment Center. I'm part of their prevention services department. And within the prevention department, there are 2 branches. So one is the Brockton Area Prevention Collaborative, and the one that I run is the Plymouth Area Prevention Collaborative. And under that, I have the catchment area of 4 towns. So that's Plymouth, Wareham, Middleborough, and Carver. And so for Plymouth, the coalition name is PYDC, or Plymouth Youth Development Collaborative. And our main goal is to strategically prevent underage substance use, and I'm under the grant Mass Call 3. And so that grant identifies substances of first use. So that would be vaping of nicotine, marijuana, and alcohol. So those are kind of like the three main substances that I'm focused on. But I'm also working to promote social emotional learning skills and positive mental health. So we do a lot with educating the communities about upcoming substance use trends. Um, this is just one example of one pager, but we also do have them on Zyn oral nicotine pouches, science of addiction, and I can forward that all to anyone who's interested. But this one is our newest one. It's on Kratom. And so, kratom is a plant-based substance that produces stimulant effects at low doses and sedative effects at higher doses. So it's really commonly promoted as a natural mood enhancer, an energy booster, a pain reliever, and sometimes as a remedy for symptoms associated with opioid withdrawal. But it can carry significant health and safety risks. Um, there are many methods of use. So, since it is a plant-based substance, the leaves can be crushed and smoked. They can be brewed into a tea or placed in gel capsules for consumption. But what is important to know is that the amount of active ingredient in kratom leaves can vary greatly, making its effects really unpredictable. So again, in low doses, it can have stimulant effects. So that can be increased alertness, physical energy, increased talkativeness. But in higher doses, it can have sedative effects. So you can feel relaxed. There can be pain reduction, decreased anxiety. But some adverse effects could be nausea, itching, sweating, dry mouth, constipation, drowsiness, loss of appetite, weight loss, anorexia, seizures, and hallucinations. So these adverse effects can be quite significant. And on this one pager, you will see that it says kratom acts on the same brain receptors as opioids. Um, and so that's something that's really surprising. And I think it's the alarming part of this substance, especially since we are still learning about this substance. Some of the resources that I took from, which I will share, um, they were just published in the last month about kratom. So this is a fast moving trend. It is one that I personally found on TikTok. Um, I want to say around the beginning of this year, it was just like one or two posts, and then I started hearing more and more about it as the year went on. Um, but this can cause delusions, depression, confusion, and can lead to addiction and withdrawal symptoms. My boss, who's the chief of communications for High Point, has said that she has heard that there are youth not in Wareham, sorry, excuse me, in the Cape who have become addicted to kratom, and they are currently being treated with Suboxone. So if for those of you who don't know, Suboxone is a medication used for those who have an opioid use disorder. So this is something that's very serious. And another reason why it is serious is because it is starting to pop up more in vape shops, gas stations. And when you see the packaging, it does say that it's for wellness, it's for energy boosters. Sometimes it's advertised like a 5-hour energy drink. But it's really important to know that it's not regulated in the US and its safety has not been proven for any medical conditions. And the FDA has actually issued warnings advising against the use of kratom due to potential harm. And from 2014 to 2019, the US Poison Control Centers actually received over 3,400 reports related to kratom use, including cases of high blood pressure, confusion, seizures, and actually some deaths as well. And I just wanted to quickly read the FDA statement that I found. So this is the statement that they put out, and I quote, "Kratom is not appropriate for use as dietary supplement. The FDA has concluded from available information, including scientific data, that kratom is a new dietary ingredient for which there is inadequate information to provide reasonable assurance that such ingredient does not present a significant or unreasonable risk of injury, illness. Therefore, dietary supplements that are or contain kratom are adulterated under Section 402 F1B and the FD&C Act. Further, FDA has determined that kratom, when added to food, is an unsafe food additive within the meaning of Section 409. Based on these determinations, kratom is not lawfully marketed as a dietary supplement and cannot be lawfully added to conventional foods. So that is something that I just wanted to put out to everyone. I hear it is starting, the wave of kratom is starting to come from the south up. So as I said, the Cape, there's a lot of it. My coworker who lives in New Bedford is seeing a lot more of it. And now I'm starting to see more signs of kratom up in Plymouth and Carver and Middleborough. And then in addition to this, I also wanted to share this image of the most recent kratom product that we have seen. So this is a drink. We didn't know that they would come in these like seltzer drinks, but it is just something to be aware of, that they can come in many different forms.
I think, to me, this is the biggest problem, that it comes in many different forms. And unless you read the ingredients in some of these energy drinks and diet drinks and, that sort of thing, you're not going to see it. The name isn't on the front of the packaging. So you have to be quite careful. The other thing that I think is important to remember, as you said, the more you ingest, the higher the dose, the worse the symptoms you're going to get. And so, someone thinks, oh, well, a 5-hour energy drink. Well, I'll take 2 of them because I'm going to be working 10 hours. So, and you get that double effect, and you don't even realize that it could be causing you to be the opposite of what you really want to be. So I encourage people to read the ingredients on any of the packages. And
Thank you,
Madison,
Carrie.
yeah, and Madison, do you hear any of your associates in high school and around drinking these, and what are they saying about them?
Personally, I've never like seen any of like people that I go to school with like drinking anything like this, or like I hadn't even heard of it until like it was actually like literally like a week ago, and I was just scrolling on TikTok, which May mentioned, and there was like someone making like just a regular video, and she talked about how she like uses kratom in it and how it like keeps her like awake or whatever, and was kind of like influencing it almost. And then after I saw that, I started to like hear more about it, and no one like locally I've heard of like anyone that I know in real life using it, but as kids, I feel like we are so easily influenced, and that's like the scariest part about it, is like it's so new and so recent, and now it's like becoming like a new thing online and on social media. So as of right now, I don't know anyone personally, but that doesn't mean that they're not out there and that it couldn't start soon, just because it is now becoming like the next like new thing, I guess.
Interesting. So, May, have you heard anything more about the legislature, the Massachusetts legislature? I know that they are working on some legislation for this. And I went out there the other day to see if there was any new legislation. There wasn't. There were some bills that had been proposed, but I didn't see that anything had been voted on or discussed. Have you heard anything?
Oh, I sadly haven't, and maybe we'll get an update this Friday. But I do know we work closely with the town nurse in Middleborough. So she's working also doing a similar presentation in Middleborough to hopefully get it banned in that town. But other than that, I haven't heard anything else. But it doesn't mean that other towns aren't doing this. I just haven't heard it.
Well, there are some towns in Massachusetts who have banned it, but I assume if the state takes care of it, then we wouldn't necessarily need to do it specifically for our town. But I just wonder how quickly they're going to be responding to this issue. And it sounds like, like you said, it started down in the Cape, and now we're starting to see it move up. So that's kind of interesting.
And
Does
then I
anybody
think
else
another
have any?
thing.
Oh, I'm sorry.
I just have a
Oh, sorry,
comment. Oh, I'm sorry. That it binds to the opioid receptor cells is a scary thing because they're going to get addicted.
They are.
Yeah.
Yeah, they are. And having to take Suboxone, that's what we treat people who have, you know, heavy addictions,
Yep.
morphine and, those heavy addictions. So I think it's not a joke. It's
No.
pretty serious. And Madison, it's not just the kids. I have a friend who works all hours of the night, and I watched him the other day down a 5-hour energy drink, and he just guzzled it right down. And I said, "Could I see that a second?" And I looked on it, and sure enough, it had it in it. And he says, "Oh yeah, I take these all day long." So older people do it too. And I think we all just need to be aware.
One
Yeah,
last
I'm
thing I
gonna,
do want to say is, again, touching upon that it does act on the same receptors as opioids. It's also really important to get this information out there because we don't know how that's going to interact with any other medication that people may be taking as well. Um, and I think we're starting to talk about it more and more with, especially for like marijuana. A lot of people don't know, and we have been trying to put that out there that like you need to be mindful that if you take any of these types of medications, that these certain substances could impact the way like the way the substances work in your body or can make it more dangerous. So I think just also keeping in mind that it can be really dangerous for people who are on pain medications,
Mhm.
blood thinners, anti-anxiety, antidepressants, that they really need to look out.
Maybe a TikTok needs to be done on the dangers of them, because that's where people are learning about it, right? TikTok. Yeah. But-
Yeah, very good points. Anybody have any other questions for May or Madison or?
Well, it's encouraging to hear that Madison hasn't seen it in the schools, so that's
Oh,
encouraging. Yeah.
that is, but then all the more reason we need to keep people updated.
yeah, I can make a comment, but I'd like to give uh, Amy, if you have any comments, if you want to raise your digital hand. Otherwise, I will just pass along. I see Devin with her digital hand up. I'll turn the floor over to you and recognize you. Hey, Devin.
Dr. Reed gave me a call earlier. I'm sorry, I missed your call. I sent out, Kingston had requested just a brief look at Kratom and relation to human health. And I think everything May said is exactly aligned with what I saw. And I wanted to also touch upon that from what I read in literature, the highest risk individuals for these really severe outcomes already are dealing with one form of substance use or another. So it's really the polysubstance use with kratom as well that is even more worrisome, I think, is that people, like you said, are kind of mixing and matching and thinking that it's an energy booster and not thinking about how it may interact with something else. And that the typical demographics skew towards white males in their late teens to middle-aged adults. So this is kind of like a lot of with. I can tell you that. And exactly what May said, that there's more and more poison control center calls that are discussing this, and a lot of the kratom calls will be in context with another exposure, but also the reported calls are intentional consumption, and that when people reported kratom only exposure, 86% resulted in one or more clinical effects when they called the poison control hotline. So just wanted to touch on that. Happy again to send around the report. Sorry, Mr. Call, Dr. Reed, but it is definitely an interesting look at what's out there.
Devin, are there towns around us who are thinking about writing a ban?
Kingston had their open public meeting on Monday. And then off the top of my head, I'm actually not on my work computer because I was having issues with Zoom, but there are several towns that have already actively drafted and put through legislature about kratom and also synthetic drugs in general. And I believe I may have distributed a few of those amongst the board. If not, I can do it again. And it looks like a lot of them are adopting a similar MAHB drafted guideline and adapting it from there. But I know somebody in, I believe, Norwell. I'll have to double check. But one of the epidemiologists I know there said that it was a slow process, but her town has recently passed the kratom synthetic ban. I would say we're getting closer to a dozen than
Okay,
if any.
that's interesting. Okay.
Before I recognize Karen, Devin, could you state your title and all of that? We know you and we know where you work and your expertise, but I think it's good to reiterate that because you're looking at it from a data-driven science data, science background, and not something from opinion.
Yes, my name is Devin Donovan. I am the regional epidemiologist for the Southern Plymouth County Public Health Excellent Collaborative, including 6 municipalities, Plymouth of which being one of them. And I was trying to rename myself, but I couldn't, but that's who I am.
Okay, thank you. Karen, you had your digital hand up.
Yeah, thank you. So just a couple of things that I wanted to also add. There are towns in Massachusetts, like Devin said, ones we know of for sure, Belchertown, Chelmsford, Dracut, Lowell, Marlborough, and North Attleboro. And there are also, different cities within our neighboring states. But what I thought was interesting, and I wanted folks to know, are there are actually some states that have banned it statewide. And they include Alabama, Arkansas, Indiana, Louisiana, Vermont, Wisconsin, and Rhode Island. So they have a statewide ban until very recently, when a new law was passed to regulate it that will take effect April 2026. So they're going to alter their ban to a regulation as of 2026. But there are certain other states and areas within our state that are working towards a ban of this product. Dr. Reed, I think you asked about if our legislature and our legislative body has been looking at this, and Kathy Lenatra, who is state rep, is sort of spearheading this, and she attended the Kingston forum on Monday, and is going to be bringing this information forward to her counterparts at the House of Representatives. Now,
That's
that
great.
being said, the state of Massachusetts usually likes to see individual towns make their individual decisions, and when they can see the majority of towns in Massachusetts want something to happen, that's when the state will usually come on board. So they want to see activity from individual towns and cities before they'll go ahead and they'll say, statewide, we're going to be doing this. So that's why I think it's so important that we start having the discussion here in Plymouth. Thank you.
Thank you. That's good to know.
Yes, Karen, thank you very much. As May's presentation, the things that concern me is the regulatory piece of it. It's not FDA regulated. It's a little fragmented in my mind, right? When you start talking local versus state and then all of that, and then different states act differently. And, kind of get in Massachusetts, you get this kind of core tipping point where the state acts on, to your point, Karen, that locally they like to see the locals do some sort of regulations or whatever bylaws, regulations, and bans and things like that in place before they do something statewide, and it's becomes kind of a who goes first kind of thing, right? Depending on, but this is a fast moving issue because of, to Deborah's point about the opioid receptors, Dr. Reed, the issue of addictiveness and withdrawal symptoms, and you're starting to see it, and the science is getting there, and it's kind of living that. So we're gonna, local regulations, and this is where public, boards of health, this is their sweet spot to act when they need to act in the public's interest, because we can, using the analogy of a small company versus a large company, small companies can maneuver very quickly, and we can do things as a local board of health that can impact the greater good and add to the conversation. So this is a great start. This lines up with what we have as our Board of Health goals in terms of awareness and education. And this one meeting is not going to be the last of this. As Karen's shaking her head in agreement, I think we're gonna, as a Board of Health, we're gonna have to focus on priorities. And I think we need to work on the most valued items as a Board of Health. And so those are my comments. Are there any other comments from the members of the board or the public on this topic before we move on to our next agenda item?
It's not my digital hand, it's my real one, but
Okay, that's
what is the price range of this product? Like I just saw, I think the drinks were like $6.99. Is it all in that kind of price range? Yes.
Yeah, they're sadly pretty accessible, pretty affordable. So those are the ones that like I know off the top of my head the price of, but I don't think many are over $10 for like one unit of them.
Thank you.
Yeah. So to May's point about access, if there's no no FDA oversight, no regulatory oversight on this, it's just like buying a Coke, a Diet Pepsi.
Yeah.
You go in, there's no age restriction, right? I don't want to put words into the mouth here, but there's no age restriction for someone buying this product currently.
Right.
That is actually something I haven't seen. I'm going to assume no, but I could be completely wrong on that. That is actually something that didn't come up in my research. I don't know if Devin, you found something, but I actually, now that you mentioned it, I've actually did not see that.
Yeah, because if you could buy it at a convenience store or a gas station, access is readily available. There's many of it, and if it's at a point of sale right at the cash register, no one's gonna. It's not like tobacco, right? Have to be 21 or older. So
What I found, it's hard to say because it's so, as you said, like fragmented. Some places have the really popular brand that is sold in a blue bottle, have I think been age restricted, maybe, but it's like, again, a sort of gas station purchase where I don't know, like, can you go in and get it? I'm not sure. It didn't seem clear to me, and it seems like right now it could very well be at the shop owner's discretion. So
yes.
I am not certain. It doesn't look like there's an MDPH level guidance either.
Okay.
Thank you.
Which is a concern. So more to come on this topic. It's a wonderful topic, and I'm glad, Dr. Reed, for you bringing this up. You made us aware as a board, and I want to thank May for your presentation, as well as if you can send us the posters, the one-pagers, that would be great, and we'll figure a way to, make this more aware to the Plymouth community at a minimum.
Of course, I'd be more than happy to. Thank you so much for giving me the space tonight.
Thank
Thank you,
you.
May.
All right, so next we have our regional epidemiologist, Devin Donovan from the PHE Collaborative, to talk about tick-borne illness in Plymouth. At our previous Board of Health meeting, we had a presentation from Blake Dinius, who was our entomologist from the Plymouth County. So we didn't have enough time to kind of marry the two. So this is a part 2 of that topic, tick-borne illness in Plymouth. Just to give us a set, what Blake walked through what happened from an entomologist point of view in tick-borne, the tick population in the summer. What can we expect in the fall, winter? And he mentioned that October is going to be a very active month for deer ticks. So that was the last thing I took out of his presentation in September. So we are now starting to be in October. And if I look out the window, it is a little wet, which is what ticks love, a little humidity and wetness. So with that, I'll turn it over to Devin. Thank you very much.
Sorry about that. I got lost in my tabs.
Okay.
Hello, everyone. Again, I'm Devin Donovan. I am the regional epidemiologist for the Southern Plymouth County Public Health Excellence Grant. I know Blake had all of the good stuff, and I'm just the numbers girl. So he and I actually got to speak recently at a tick-borne sort of Cape Cod meeting, which was very helpful. So hopefully I should now be able to share. Let's see. Share screen. Okay. And are you able to see the screen? Fabulous.
Yes.
All right. So thank you all again for letting me present today. So what I will kick off with is our 2025 year-to-date tick-borne illness report. So to date in 2025, this is again a little bit out of date now because it's from September, but there were 295 confirmed probable and suspect tick-borne illness cases. So standout figures, 1 in 3 cases is an adult over 65. More than 60% of cases were male, and nearly half of those cases came in June and July, which, as you will see, is like peak tick season. And this is just Plymouth data. So as you can see, I also put the kind of ticks that you see in Cape Cod. I stole this from their epidemiologist, but I think it's very helpful to look at, again, of what's common and uncommon. Deer tick is our #1 enemy, as Blake said, so I won't hammer that in too much, but that's who we really have to look out for as well in the winter. Then what I did is I zoomed out 5 years, and I just wanted to see what is going on. And by disease, because different ticks carry different disease, Lyme is 80% of all tick-borne illness reported in Plymouth. So really, the other runners there, anaplasmosis and babesiosis, about 10% each, but Lyme is by far and away the biggest reported illness here in Plymouth, which tracks as well because Blake talked primarily about deer ticks, and that's who carries Lyme. The other 1%, those are things like Rocky Mountain spotted fever, tularemia, the ones that would be classified as like rare but can happen. So it can sometimes be a question of, for example, ehrlichiosis is one of the diseases that isn't always tested for on a tick panel. So is there less ehrlichiosis, or are we just not testing for it? it's a question that keeps epidemiologists awake at night. But really the takeaway here, Lyme is by the biggest threat here. So then what I did is I wanted to spread it out over the course of a year. And what you see is tick-borne illness. Yeah, surprise, surprise. June and July are still the #1 kind of time for reported tick-borne illness, but you'll notice that they don't exactly drop to 0 during the winter. Deer ticks can be active even in temperatures above freezing and if there's a break in the snow cover. So they want to be in those shady, damp, brushy, wooded areas. So then you'll notice as well that even in the warmer seasons, April, May, it's like a lag. And then suddenly June, July, August, there's this big jump. It's usually because symptoms take a minute to appear. So something that's important to note is that a lot of reported tick-borne illness is in older adults, and it takes a few weeks for people to notice because some of the most common symptoms of tick-borne illness are joint fatigue, just pain in your muscles, feeling really tired. And sometimes what people will say is that, you know, oh, geez, I'm getting a lot older. I can't move as well as I used to. And they may not recognize that that's tick-borne illness. So it's important that if you are someone who's really active and outdoorsy, always do a tick check, like Blake said, but also, you know, it never hurts to talk to your doctor. If you're not feeling like you can move as well as you used to, that fatigue and pain might not be normal. Definitely speak to your doctor. And then I have my cute little animation to say, again, deer ticks, they're hanging out in the winter. They are there. They're not going anywhere. And the adults are the ones that are, as Blake said, the ones to look out for. Okay, so then after I did caseload by month, I decided to look at by age group. So what I calculated is called incidence. So incidence is the rate at which people become ill. So to interpret a graph like this, you would say, in a population of 100,000 Plymouth residents, we estimate that approximately 200 children under the age of 5 will get sick with a tick-borne illness. And you can see that if you, again, look at like under the age of 5, I don't know if my laser pointer shows up, but under the age of 5 is where you can see that. So, and again, it's important to remember this is a 5-year spread. Different years, year on year, will have different rates of infection. So this kind of just standardizes like a 5-year zoom out. And that helps us visualize overall trends and also allows more transparent data sharing because we have a bigger population. So my question to you is, we can see the older adults, as expected, are pretty high, right? But does anything else stand out to you in this graph? You know, I won't drive it. I'm just curious what you see when you look at a graph like this.
There's a dip. I would say that there's a dip in the age from, you know, middle age from 20 to 35. The incidence goes down and then it really takes off from 40 on. And you know, when you look at this data, it's important to have, you know, how are we gonna react to this? So, you know, we do have a CAL, Center for Active Living, and you know, maybe this is an opportunity to do some further awareness around tick checks and ticks, because they are the highest incident rates from 64 or 65 plus.
I actually just did a Cal Connections today about ticks and mosquitoes.
Awesome.
Yeah,
yeah,
that's great.
Yeah, and it was that they were really, the folks that attended were very pleased with the information, and I shared with them a little tick kit with a magnifying glass and a pair of tweezers and a little instruction booklet on what to do. I shared some of Devin's data with them, and also talked about obviously prevention, you know, which is really what the goal is, right? You want to prevent them from being on your body so that these things don't happen to you. So we talked a lot about that too. So we're going to probably do it again around March. We're going to have another,
Yeah.
so before the season, season, it's really almost all year now, but where the outdoor season starts for our residents. So we're going to do it again in March.
I see
Definitely.
Deborah's, before we move on, Devin, Deborah has a question.
Yeah, is there anything that can be done to decrease the tick population?
Yeah, that would be a better Blake question than a me question, but he would probably say prevention is the best thing we have right now. And also treating your clothes with permethrin. But I am not super knowledgeable about, hand-to-hand tick combat per se. So
That would be the
that's
easiest, right? If they could just drop a smoke bomb or something.
Oh,
Okay.
we do in Plymouth as well as the county spray for mosquitoes. So is there an intervention like that that's available for ticks? I don't know. To your point, Devin,
Yeah.
it's a better Blake question. But we do have interventions around mosquito spraying and things like that for that. So
Definitely. What I'll also point out about this graph is 5 to 9 and 10 to 14, this nice little bump comparatively. That's like prime summer camp age, right? So a lot of these kids that are out running around and kind of at these outdoor activities are also living in Tick City. So important to do their checks too. If they're going to summer camp or sleepaway camp, whatever sort of activities outside, they see a nice little bump too. But really, like you said, it is a lot of the older adults, and especially because there's a lag in the symptoms and you might just think you're getting a little older, it can be so hard to recognize those symptoms. Alrighty. So Blake did this last week. I won't do a ton about it, but of course you want to know where to expect ticks and dress tick smart. So permethrin treated clothes is really a great way to do that. If you're a big gardener, just have that set of clothes that you use. Tuck in your clothes. If you wear light colored clothes, that's usually not what I'm wearing. I usually wear black, but you can spot ticks very easily. And also putting your clothes in a dryer on high heat for 10 minutes can kill them. And always checking in those key places. And there are EPA registered repellents that you can always check out. And again, I'll share the link to this. You can just type in EPA tick repellent and they have a whole list of what they recommend. Then I really recommend the Cape Cod website about tick-borne illness. They keep this up to date because if you think our ticks are bad, their ticks are way worse. And I also plugged Blake before I knew he was coming. He's really the guy that knows it all. But capecod.gov, if you type in Cape Cod tick-borne illness into Google, it should take you to this page. There is so much information about prevention, spotting a tick, how to remove a tick, all of this stuff. It's updated pretty frequently and it's not that far. Ticks don't respect borders. So I really recommend their website. It's super thorough. There's also Tick Encounter with the University of Rhode Island that is really knowledgeable about tick stuff. They have something where you can submit that photo of a tick and they'll identify it. Blake has tested it with like super hardcore stuff, but if you're doing just what kind of tick is this, it can be pretty helpful to know. Alrighty, and then if you are a data nerd like me, you see all these charts and graphs and think, ooh, interesting. The Massachusetts Department of Public Health releases an annual statewide report every year. The 2024 report is available. And there is a little bit of county and town level data. There's a lot of data visualization and 10-year trends by different tick-borne illnesses. So you can go check out the mass.gov website. It is pretty heavy-handed in the language and a little bit jargon-esque. So if you are really interested in public health data and statistics, I recommend it. There are some interesting graphs, but it can be a little hard to read just because it's very much driven to, data nerds like me. But that being said, I always think it's really cool to check it out. And I will just leave you with one of my favorite prevention quotes: an ounce of prevention is worth a pound of cure. So if you can, like Karen so aptly said, get the tick off of you or not have it on you, that's the best way to prevent the illness. And that is my plug. And if you think of anything you'd like to ask me later after the questions, this is my email. I cover the town of Plymouth as well as 5 other municipalities, but I am here to help out and answer your questions, all things data. So feel free to shoot me an email, or I can also provide my work cell number if you'd like.
Well,
And with
thank you,
that, that's
Devin.
everything I have.
Yeah, thank you very much, Devin. This is important data, and for especially, as you say, data nerds. That's fine. We draw insights from science and data-driven things. So there's a basis for the insights that we're coming through, and those insights drive policy. They drive where investments are going to be made, where limited resources are going to be spent to do the best, most benefit for the most good. So I appreciate your efforts and giving us some awareness and education today. Are there any other questions from the board or Madison, our student representative, as well as the department division, Karen or Margaret?
No, thanks, Devin. Great
Thank you,
job as
Devin.
usual.
Thank you.
Very informative. Thank you.
Yes, thank you.
Happy to do it. You'll probably see me later when I come to talk about respiratory illness. So I'll be
Yes.
back.
Yeah, and you know, this tick, the tick, I'll call it the tick thing. It's never ending. So we will have this discussion again next year as kind of a public service announcement to just keep, drilling the message, because it is impactful, at least in our area, and it's something, Lyme disease isn't something that you want need to take lightly, because it is a long tail on the road to recovery from Lyme. So I know that
Definitely.
friends and acquaintances, not personally having disease, but it is it can be debilitating, for lack of a better term.
Absolutely. Yeah. So anything we can do to help prevent and identify, I'm all about it. Thank you all so much.
All right. See, Amy's at her desktop. We're going to go to the next agenda item, just some member updates, and that's primary focus of this meeting. Now that we've gone to 2 meetings a month, from a Board of Health perspective, is to get member updates, as well as some of these presentations from our partners across our region. So Amy, do you have the goals and objectives you'd like to walk us through? Can you share, or how's that?
I can. Let's
Okay,
see.
thanks.
I just need to. I don't. Oh, do I have the ability to share?
Should be the
Oh,
green.
right here. Sorry.
Right on the- Yep.
Here we go. All right. So just I don't know if you guys remember, a couple of years ago, or every year we kind of go over our goals and objectives. I was talking through this with Lorenzo. Our main focuses for the Board of Health has always been education, awareness, and community presence. So I just wanted to highlight the guiding principles for the town of Plymouth. So I know this was discussed at a select board meeting. The Plymouth Board of Health accepts the guiding principles for the town of Plymouth as reaffirmed by the select board on June 3rd. So right there, if anybody wants to know what those are, there's the link. So one of the biggest things we deal with Board of Health training, member training, and onboarding manual, like this would be wonderful if there was one document that we could just read and then know everything that a local health department does, but that is impossible. So, for a few different, places you can go to, there's the Town of Plymouth, the Public Health Board of Health website. I think that the health department has a great website for the for the town of Plymouth. I know I've taken things directly from there and put it on my own website. Mass.gov, there's the manual of laws and regulations relating to boards of health. And then the MAHB has a legal handbook for Massachusetts boards of health. And I'm pretty sure we have access to that. Are we members of the MAHB? Yeah. And so we have access to that, which is very comprehensive.
Amy, if I could stop right, just
Please.
make a comment while we're there. And one of the things for me, I'm pretty process oriented, as you all know, and having some structure is important. And so these are the kinds of things to put in place so that, succession, people doing, the future chairs and vice chairs and members of our Board of Health will have a well-trodden cow path to do what we do as a Board of Health. And that's one of the things that this year is a personal goal of mine, is to have some consistency and a way to do that. And I may be able to add to an additional bullet point there and saying, what do we do when we have our meetings? How do we run them? What's our cadence and kind of things as we go along? So I just wanted to add that as this Board of Health member training and onboarding, because things change. We all change. We have our priorities, and they do change over time. And I think it's good to have change, because it lets other people step up. It's not entitled continued appointments and things like that. While there is good to have history and experience, I think there's also equally good to have new perspectives. There's such a resource of public health expertise in the town of Plymouth. One thing, and I want to, and this is good for both the division as well as the current board, is that I did get feedback from a select board member that they were amazed at the level of expertise. Not everyone can be an expert in everything, but the composition of our board, and with the support of the division, is they just couldn't say enough good things about what a great team we have in collegial interaction. So wanted to say that. Thank you, Amy.
So when we talk about our goals and objectives and our regulations around in some of our accomplishments that we've done in 24, 25, we were doing calendar year, and then I kind of switched to fiscal year because of when I got to this. So when you think about what we've accomplished in 2024, 2025, we banned polystyrene food and beverage containers. We talked about integrated pest management and rodent control. We had public comment policy. Lorenzo and I talked about this a little bit. We passed in September 2024 a Board of Health public comment policy. We talked about poultry regulations, and the board relinquished that to the Agricultural Commission, where it's better suited for the expertise that they're able to offer. And then we are still in the process of tobacco sales regulation updates. Does anybody have anything that I missed, or anything you want to comment on? If you want to talk about which your favorite was. All right, I'll move on.
Mm-hmm.
So community engagement is another one of those topics that we really want to focus on as the board. So, our outreach efforts to facilitate panel discussions and forums, and then our collaboration with schools, businesses, BID, Leahy Plymouth, Plymouth County Outreach, and other government entities, which, we can see here with all of the updates we'll do, and with the other people that are coming in to talk to us about topics. So some of the things we've done, the NDCAP and public health implications of nuclear waste, did a presentation in January of 2024. We had a discussion on styrofoam takeout containers and the public health hazards in January 2025. Proposed amendments to tobacco regulations regarding nicotine pouches, that was in March. Our partnership presentations, the Green Team Plymouth Schools Composting and Recycle Initiative in February 24. Emergency management planning, we've had collaborations there. And then we've had the student reps from the 4 different schools.
Amy, if I could,
Yes.
through the chair, I think we also had a public forum about rodenticide.
Yeah, did I put that in the other one? Oh, oh yeah, we did. I'm sorry. I forgot to add that. We did, it ended in the public policy, but you're right.
That's good. We'll edit that from future.
Yeah, gotta give credit.
I know,
we
I
have to
will,
get credit.
yeah, yes, that
You're a
was
very
it.
busy board. You gotta get credit for everything that you do.
I know, it's hard to go through and figure it all out. But thank you very much. Did I miss anything else? Or does anybody have any other topics that they thought were important? Like, even if it was just a discussion topic that we mentioned at a board meeting, if anybody wants to highlight that, if they thought it left them thinking about the stuff.
Nope.
No. All right, so communicable disease control and chronic prevention. So these are some of the topics when we first started talking about what the board was interested in. We came up with opioid abuse, obesity, tobacco, alcoholism. And this actually makes me think about how when the community health survey that's in process right now, I'm so curious to see how our topics align with what the general population in Plymouth think. I think that'll be really interesting to be able to build on all of that for the board. We had the 2020, 24, 25 presentations and discussions about communicable disease. We're always talking about COVID, influenza, pertussis, hepatitis B and C, H5N1 influenza, RSV updates. We had very interesting conversation about radon testing and lung cancer risk, methylene chloride containing paint stripper warning, testing for lead content in drinking water, CBD and THC Delta 8 and 9 warnings, tick and mosquito-borne disease update with Plymouth County Extension. And we do that every year. Is there anybody that wants to add anything to this? Did I forget anything?
No, the only comment I have is that it's quite a list, right? And it's about prioritization. We heard another one today with May's presentation on Creighton, which has some of these things have regulatory oversight already, and it may not be the front burner kind of things that we have to, as a local board of health, decide. But we have, just like any other entity, we have limited resources, limited bandwidth, and we gotta be good with where we spend our time and our and mental efforts and follow-ups. So thank you for memorializing this, because it is a lot, and I couldn't remember, and I think this document is great for that, for memorializing what we've looked at, and then we could say, all right, we'll move on. What are we doing in 26 and 27? So
yeah, and what might we need to revisit from 24, 25, or even 23 and certain things. I think it's interesting, the conversation that I thought that presentation on Kratom was very interesting, and to see, where we start. And there's always like these movements in public health, especially local, when you think about what Karen had said, where the state says, oh, maybe, we'll pass something. We're going to talk about it. But really everything, it starts moving in local public health, and it's local board of health regulations that start the movement. And sometimes it catches on and sometimes it doesn't. So, if we talk about Kratom now, and if, say, Plymouth decided, now's not the time for us, but we see it kind of pick up. And we've talked about that with nicotine-free generation, saying it's not the time for us at this point in Plymouth, but maybe at some other point it will be a time, depending on where the movement goes, or maybe that would fizzle out. Like, it's really interesting to kind of see the way things go with public opinion and support, really. Not that we're all about support, but it's definitely a consideration in what we do.
Yep.
So social determinants of health. So healthcare equity, food and housing insecurity, environmental health hazards, especially carcinogens like PFAS, cyanobacteria blooms, and then sustainability, recycling, composting. We've had a lot of discussions on that. Stress Awareness Month, Plymouth Board of Health opinion on Plymouth Town Meeting Article 12, summer health and safety, insect-borne diseases, sun protection, water safety, heat, illness, risk factors. All of those are very important things to kind of bring up within this structure, within this environment, so that we can talk about how it impacts public health. Is there anything anybody else wanted to talk about with social determinants of health? Or maybe some topics we might want to cover in the future?
Yeah, I think Dr. Reed had a presentation on the sun and summer health, right?
Mhm.
That was good, and it's kind of, you know, where we live, right? We have to, and we know this from public health, kind of impacting behavior. It's small steps at a time, consistent reminders, consistent messaging around it, and that's how you get behaviors to understand it, you know. But it is work, and it sometimes can be rote, but it's nonetheless important to reiterate the message. So thanks.
I I did do a talk about the um, electric bikes
Oh, you did.
as well, and safety around that. I should have included in that the electric
The
the
e-bikes.
scooters,
Oh, yeah.
not the bikes, but the ones you stand on.
Yeah, the scooters. And through the chair, if I could, Lorenzo, I just wanted, now that we're talking about e-bikes, I just want to let the board know that the select board is discussing that Tuesday, the 14th, to actually put together a bylaw with rules and regulations for the use of e-bikes and motorized scooters.
Good.
Mhm.
No,
I know
that's
because
another.
they're in the streets at some of these
Mhm.
motorized scooters and they're so dangerous.
Yeah, and not just in the streets, they're going off-road, they're going on our beaches, they're going,
Oh,
there's a lot of places they're going to that really, because they're smaller, they can get through areas where we're blocking that off for car traffic. But they're the
oh,
same thing. They're still motorized. You know what I mean? So our goal was to stop from motorized, um, you know, objects, cars, whatever, going past a certain point. So now we really have to tweak that a little bit to include e-bikes and motorized scooters.
good.
No, that's great. No, it's
Good.
good to hear. Thank you, Karen, for that,
Sure.
because, you know, these are things that impact the overall health of our community, right?
Absolutely.
It's
Yep.
moving towards
And that's what we
health-related.
want to do, right? We want to keep our residents and our visitors safe. So,
Yeah.
you know,
I know, and
Exactly.
if you think about like the movement of bicycle helmets in general, you
Mhm.
know, having grown up in the 80s when a bicycle helmet was unknown, and then you know, making sure that people start wearing helmets, and it is again a behavioral change. And I think that sounds like the e-bikes are kind of coming down that road too. Great.
I mean, not to one up you on that, Amy, but seat belts for me growing up,
Yes.
you know, Madison probably doesn't know what seat belts were not required, and your parents, you know, it was a lap belt. It wasn't these 3-point seat belts, and there were no
If you,
airbags. You
yeah,
know,
if you even had them in your car.
Yeah,
right?
right.
I'll even go to leaded gasoline if we're talking about public health hazards and cars and
Yeah.
We've come a long way.
yep, yep, we've got a long way to go. Like and then just thinking about that, like looking at PFAS on our list, you know, we're inundated by information about PFAS over the past 5 or 6 years. But before that, we never even talked about it. And now, you know, understanding the health implications and still we haven't banned them in this state, you know, and it's we're talking about treating water and not using them, but they're still being produced. So we have a long way to go on that too.
Absolutely.
All right, so these are the fun things, the things we want to start thinking about for 25, 26. And this is stuff that we've talked about at different board meetings that I kind of wrote down.
Mhm.
So, we definitely want to explore and investigate the connection between cyanobacteria and septic systems surrounding local water bodies. I am amazed at how many cyanobacteria alerts have come out. And I saw one was recently reinstated, and these are the ponds we know about, where, I mean, I don't know, Karen, if there's a lot of people that call in or if they know, because I mean, I can't imagine you or Margaret going around to every 350 something ponds to check the cyanobacteria. So that would be a very interesting study to think about the septic systems around ponds and cyanobacteria. I mean, definitely that we want to continue our collaboration with the public schools and the Health and Wellness Committee, the assist with the community health assessment, community health improvement plan development and completion. I think Meg works on that directly. Is that right?
Yeah, I
Yeah.
got an update for she couldn't be here tonight, but it was a great segue. She sent me an email and I'll talk a couple bullet points and updates on that.
Oh,
So
okay,
it's
good.
great. It's great. Good.
Oh, good.
So it's good that we're involved, right? So we have our whether they're appointments or whether they're liaisons, whatever they are, we as a board, where we can, are engaged with other entities within the greater public health realm in our area.
Yeah, and I love the Southern Plymouth Public Health Group, the collaborative, to work with the Plymouth Health. We have a whole profile in there that Devin has outlined all of the hepatitis B and C, education prevention, binge drinking awareness, education and prevention, cancer incidence investigation, low ratio of primary care physicians, that directly affects public health. So I think that profile that she developed is a great place for us to look and see where do we want our priorities to move, which, again, emphasizes the need for the epidemiologists that have been popping up around the state. I think that they're instrumental in moving local public health forward to the next level.
Mm-hmm.
And that's it.
Well, that was great. It's been a long time coming. We've been pushing it off, and really appreciate the work that you put into doing this. I mean, we're all, yeah, we like to say, but engaged volunteers. So thank you very much.
Yeah, very good, Amy. Good job.
Very good.
Madison, any comments from a high school or student perspective on what you just saw? Because you're gonna start your career and you're gonna have to, come up with these overviews to your management at some point in time, and this is how you do it.
Yes, I thought it was very good. Sometimes we do like slideshows in school, and I'll look at some like my friends in the class's slideshows, and they're like not keeping me interested. I like have no idea what's going on, but that one was really good. It was organized. I knew what was happening, and it was very engaging.
All right, thank you, Madison. I didn't want to. I'm sorry for putting you on the spot, but
It's okay.
it's something, as Dr. Reed says, you're starting a career being a senior. You're going to go through advanced, education, go through your bachelor's and maybe postgraduate work, and then working in our economy. And these are the kinds of things that you got to get good at showing what we did.
Yeah.
All right. Next, I'll provide a quick CHA CHIP and PHE update. I know Meg's our appointee voting member, and Karen's involved as our alternate, so she can keep me honest with some of these bullet points and provide some color. But on the CHA, the Community Health Assessment, and the CHIP, I think is the Community Health Implementation Plan, that the town of Plymouth, and really the HHS, the Health and Human Services area is, you know, that umbrella is really working with a consultant. Health Resources in Action, HRA, is the company that Plymouth or HHS has contracted with to conduct the CHA chip. They are reporting 496 surveys have been completed in English, with 600 more in progress. But the flip side of that coin, or the bad side of that coin, is that there's only 2 surveys that have been completed in Spanish and 4 in Portuguese. So the group is looking to get more representation from young adults, men, and non-white residents prior to closing the submissions of the surveys. Meg sent me, and I'm sure we've seen it, is the actual email that goes out marketing the survey. If somehow we could put that on our website or link to it on our website to be part of, do our part to get more engagement and more surveys in that. And maybe also to brainstorm, how do we you know, access certainly a population or a segment of the population that's lacking in the surveys. And so I think that's part and parcel what's on the CHA chip steering committee's mind.
If I could add just something really quick, Lorenzo, I did have a meeting today that included Emily Wilson, who's the Assistant Commissioner for Health and Human Services. And I think that there is going to be an effort to bring those surveys to Algonquin Heights and also really concentrate on the North Plymouth area. English is not a first language, you know, groups that might be there because the survey is in different languages. We can share that with folks. So there is going to be sort of like a boots on the ground push now to get those numbers up for those types of groups.
Yeah, because you don't want it skewed with the data, right? You
No,
do,
and you want to hear from everybody because the more people we hear from, then the more of a clearer picture we're going to get of what are the needs of the people that live here. And I just want to make one other caveat too. It's also if you work here, if you live and or work here. So anyone who might listen to this who works in Plymouth but doesn't necessarily live in Plymouth can certainly take the survey as well.
And it's not limited to an age. So
no,
folks in high school, Madison,
absolutely,
is
absolutely. Yep.
Think in the back of how you can get your colleagues, maybe in a newsletter or something, to say, hey, there's this survey, just let's take it. You know, I always think about incentives, like give someone a Dunkin' gift card if you fill this survey. I bet you'll get 1,000 surveys. You know, 60,000 surveys. You'll run out of Dunkin' gift cards if you do
There
that.
There are 3 giveaways I think that they are doing. That you put your name in a little bucket if you do the survey. Now the survey is totally anonymous.
Yes.
However, if you want to fill out the little slip of paper that goes with the survey, you could enter into a contest, and I believe there's 2 tablets that they're going to be giving away, and perhaps I think it's an Amazon gift card. So there is something that you could enter.
Right. Good.
How are the surveys going out? Is it just through the website?
No, there's several different ways. You can actually get paper copies if you wanted to at the library, here at my office on the first floor of the town hall. There's paper copies at the Center for Active Living. But there's also a QR code. There's a QR code on our website. There's QR codes all over town that you can scan with your phone, and then you can take the survey right on your phone or your tablet or whatever it might be.
Yeah.
Or would it be appropriate to, like, if you advertise it like on your Facebook page or?
Oh, you can absolutely do that.
Yeah.
Yeah, you can absolutely do that. Yep.
And I'm sure Casey Kennedy's involved, right?
Oh yeah, absolutely.
Absolutely. So I didn't even want to go there. I just, that was like, you know, like motherhood and apple pie. Baseball, you know, I know that Casey Kennedy's involved. So I'm not even gonna go there. But anyway, the last bullet point around the chat chip update from Meg was that the next meeting, the last meeting was canceled, but the next meeting is on October 14th. So more to come. And then on the PHE collaborative, I'll just go through the bullet points you gave me. Dr. Potman was reelected as the chair, though not a voting member. The search for a public health nurse continues. There was an RN who ultimately withdrew her application prior to the second interview. The committee is going to decide whether or not to repost the position again. There's been some, I joined the last PHE online meeting, and there was discussions around, focusing on school nurses and people who, if there were multiple applications for a school nurse, maybe we can get some ideas around it. So they're working on it. They're definitely down the right place. There's enough intellectual capital there to come up with some good ideas around that. The committee is eager to offer more education and training around maternal child health. So the committee's in the process of gathering data and coming up with a plan on that. Devin provided an update on what she has been working on in the various towns. That's part of the collaborative. So she's a big part of the resources there. And then the group spoke again briefly about kratom and synthetic drug regulations in the area, NEDM, and then Devin has forwarded some of these regulations that are in our area, and we'll take a look at it in future Board of Health meetings that we'll discuss and then move forward with that. And the next collaborative meeting is on October 22nd. So more to come from Meg on that. Our next updates for that will be the first meeting in November. So for that. Next on any questions on that? All right. Next on the agenda is Nuclear Decommissioning Citizens Advisory Panel. Barry, Dr. Poppin will provide an update at next month in November. He's not here with us today. He didn't provide that, but so he'll provide that. Next is the Plymouth Youth Development Collaborative. I know we talked a little bit about, we had May from the collaborative kind of go through that, but did you have anything to update us on, Dr. Reed?
No, I think she did a nice job of explaining what they do. And I attended the meeting on the 12th of September, and we're having another one in a couple of days. And I'll just keep you informed about the activities of that group. It's a good group, a lot of good ideas.
Thank you. Now,
And then the other
school
one
nurses.
that I'm involved in is the Plymouth School Nurses Wellness meetings. They haven't had one yet. The first one is on November 19th, and I will be attending that. That's another great meeting because the school nurses are involved, and they really, they know their clients well, and they know what's going on in the areas that their schools are. So it's always very educational.
Yeah, maybe we can take a poll from them around the subject of kratom if they have any insights to there, because
I will ask them. I will ask
yeah,
them.
yeah.
Yeah.
Okay. Any questions for Dr. Reed on her two updates? No. All right. Next is the Citizens Advisory Committee. Now we talked about reinstating this. I actually came up my involvement in the Plymouth Board of Health through the advisory committee, and would meet with the chair at the time, Dr. Potvin, and I think there was another person, but then it just became a one-on-one kind of check-in over time. But I'd like to reinstate that. There's already kind of a roadmap or a plan involved, and Karen will help get the word out, go through that process, and then from a Board of Health members perspective, if you have any folks that you think that are good candidates to be part of an advisory committee, tell them to put their hat in or check out the website for future advertising around that. I know I met someone through the town meeting caucus meetings. I was at a precinct 10 caucus, and there was a town meeting member who was in healthcare executive in their previous life, and now doing some other things. But I said, hey, we're getting together, I'm on the Board of Health and we're getting together a Citizens Advisory Committee. Are you interested in public health? I know you got a lot of things going on. And lo and behold, he did say, I'm interested, let me know. Because that's my wheelhouse. I was involved in health care ecosystem and would like to get involved in that. And I said, perfect. We could use, more folks within the community to be resources and have kind of a, hate to use well, I like to use the baseball analogy because it's playoff season. AAA and the major leagues being called up to the majors to
I refer to
part
it as
of,
varsity and the JV and the varsity team.
yeah, JV and varsity team. So, but and I said there's going to be structure and things, and we don't expect you to be at maybe the blocking and tackling the meetings with that we have, but we do have a meeting that's really focused on some discussions around what's front and center in our community. So like this meeting, so this is great. It's just discussion, openness, and sharing ideas and information. So any questions around that? My ask for the board members is just if you have someone in mind, recruit them, and we'll get more information on how to submit your name in the hat. And I think we're going to limit it to 3 folks, Karen, and we'll go from there. And then last discussion is tobacco regulation, and I have all for this is that we've been going through this as Amy showed it on our goals and objectives and kind of memorializing that. And so I took a different tact. I wanted to say, and I asked Karen, I said, is the current regulation that we have on the books limiting the public health division in doing its job in inspections and things like that with respect to what we were talking about, nicotine pouches, tobacco, and in general. And I don't want to put words in your mouth, Karen, but is there something that we need to change from a public health division perspective that would make or support your job, the job of the division better, or the division of, or the job of Bob, I think our inspection person?
Bob Collette. I think the goal for our tobacco regulations obviously is to make sure that everyone is following guidelines that are established to make sure that sales do not happen to people who are under the age of 21, because that is established by the state of Massachusetts.
Yep.
Also that here in Plymouth, that we don't have flavored products that are sold, because that's against our regulations. I think with the current topic that we've been talking about is the nicotine pouches. And I think that we might be getting a little bit into the details with that, with the 6, is it below 6? Is it over 6? Should it just be adult only locations? I think the way our regulations are written currently, if you can't buy those unless you're over 21. End of story. You can't sell them if they're flavored. That's also a violation, and no matter what age, you can't sell those. So again, it's to the board's direction if they want to add an additional layer of saying that either you want to say that only a certain microgram can be sold, that 6 seems to be the magic number, or if you want to ban them all completely, or if you wanted them to go to only over 21, to your true tobacco smoke shops, where you have to be 21 to actually enter. That's at the discretion of the board.
Mhm.
the department's gonna support what the board does, but the way the regulation stands right now, if you sell to someone who's under 21, you're gonna get a substantial fine. If you, do it more than 3 times in 3 calendar years, you're gonna lose your license. So the consequences are established. They're already there. You can't sell flavored products. So again, we are getting a lot of feedback from our business owners that are hoping that they can continue to sell this product appropriately to people who are over the age of 21. But again, it's up to the board's discretion. I think the division, I'm sorry, believes that the way that it stands now, it certainly does protect the public and the under 21-year-old population from buying them.
Yeah, and I want to open it up to the board, and Amy, you've got your hand up, so go right ahead. I mean,
Yeah, I mean, I have a couple points. I think it would be a different discussion if we never had sales to minors. So we can see a giant uptick to sales of minors when we do 1 inspection a year. And that's concerning to me. And we've definitely handled that appropriately from the board's perspective. And the other thing, I was recently watching a webinar about nicotine addiction and just how awful the addiction is. So yes, we definitely want to protect our underage kids that are, under 21 from pouches and nicotine. I don't think we need to get rid of nicotine pouches, but I think by minimizing how much nicotine is available at one location, at one time, I think that will help with nicotine addiction. The more nicotine you're exposed to, the more likely you would be to be addicted. And what it does to your brain is it's addiction's addiction. Nobody wants that. So I feel like I would be supportive of, and they do this with, I think Mr. Patel brought it up in his email about the adult only stores. When you think about vaping, I'm not opposed to, if we had 6 milligrams at under 20, at convenience stores or retailers that allow people under 21 in them. But then I've noticed in my experience that the adult only stores truly are much more, I rarely see a sale for a place that is an adult only retailer. If the higher nicotine level is there, that's a different thing. Again, I'm concerned about addiction for any age. And then, and I agree with Karen that flavors are banned in Massachusetts, but nicotine pouches, and we'll see this coming out soon, some of the professional public health organizations in Massachusetts are working together to come up with a list of flavored pouches, because they don't call them mint, they call them cool or crisp, or and that's something. I know there's some boards that do the sniff test. They bring the products in and they smell it, or somebody might smoke it and breathe it at you, or that kind of stuff. But I know there's a group that's doing it together, the MHB and the MHOA and the MMA and all the people that are working on tobacco control will be able to come up with a list of pouches, because they're just trying to get around rules that have been made. And that's concern. And it sounds to me, not that I've worked directly with tobacco, but the people who have worked with the tobacco industry, this is common for them. So that's why with nicotine pouches, there are flavors that soon there'll be a list, and as a board, I hope we would adopt that as, we are saying that this list that these professionals came up with, that say, jazz is a flavor, then we will say, adopt that. But I don't think it's ever as cut and dry as as you know, flavored versus non-flavored, because the industry's always trying to sneak one in.
But
So I
do
would
think,
be,
yeah, I do think, sorry, through the chair, Amy,
Mhm.
I do think Bob Collette is very good about that.
oh,
Because
he knows the like he knows
oh,
what's, yeah,
absolutely.
yeah,
Absolutely. The name, the different names, like you mentioned, like cool or ice blue or,
yeah, yeah, yeah,
yeah, there's a cherries. I mean, not even like naming something, but they
yeah,
do. It's like more of a feeling, you know what I
yeah,
mean? Like, cloud or so, I mean, it's something like that.
yeah, it's
He's,
ridiculous.
yes, he is very good about that. And we're educating our retailers to say that, no, that's still calling something a flavor. A flavor is not just like, sweet, sour. It's these terminologies too that try to mask the fact that it's a flavor. But of course it certainly is, because something's not going to be, like blue if it's just normal. You know what I mean? You're not going to call it that. You know what I mean? You're calling it something so it becomes more attractive. And that's really what
Hmm.
happens, right?
Hmm.
You're making the product more attractive because you're calling it something else.
Right.
So, but my point is that Bob is his team is
Yeah.
very good about that, and he shares that with
How,
us.
yeah, how often is Bob does one inspection a year and one
If,
compliance check?
if you're if you if you're if you're I don't want to say good, but if you're
Yeah.
compliant,
Okay.
you're once a year.
Yep.
If you have been non-compliant in the past, it can be 2 a year.
Okay.
Mhm.
So yeah, and I mean I'm sure he is. It's the oh, Bob comes in and does his inspection, and then the next day somebody starts bringing in the purple sunset or something, and that's the kind of stuff that I think is concerning. So I would I'm in favor of a 6 milligram limit for pouches. If the board, I would like it all like straight across, like without adult only, but if the board felt strongly about allowing people access to higher limits of that, then I would hope that they would only be allowed in adult only retailers. But I mean, it's, yeah, I'm also thinking like, so you've got 6 milligrams and you want 18, then they're throwing 3 in there. Like we're not limiting the access for the people that feel like we are over regulating. We're just trying one small movement towards reducing addiction.
Mhm. And that's a good, this is a good discussion, and we want to hear all of these things, because I was trying to understand from that perspective, are we doing something that is needed? And I think it's the fact of the matter, or the intent, is that we have a concern, your concern, and can be shared by other board members, of addiction. And so how do we make an incremental step to reducing addiction? Karen, and nicotine pouches and tobacco, we have a certain number of licenses in Plymouth, right? It's like 40 plus or something. I don't know the exact number, but those are the number of retailers. So those are the inspections that Bob goes to each year on a one a minimum, and if they're not compliant, 2 a year. And
Mhm.
with respect to the number, uh, and I haven't found this, but I did pull some information from MassGov, and I think that 35 milligrams or higher is only at adult shops, and they can sell flavored pouches at those shops. Is that true or not? So no flavor at all, no matter what, whether it's
Correct.
adult only or shop, it's no flavors at all.
No
And
flavor.
that would be something in the inspection, that
Mhm.
if you're selling flavored things, you can't say, oh, I didn't know I was going 50, 60 miles in a 55 an hour zone. If it's flavored, Bob knows it's flavor. And you're going to go in front and get
Mhm.
cited for it, and then you'll have the opportunity to talk through that at the Board of Health hearing, I guess, for lack of a better term.
Mhm.
Around that. Is that
And we've
how
worked
it
with
would play out?
distributors. Yeah, and we've worked with tobacco distributors who distribute to all of the establishments to tell them, you should educate your folks too, that you're selling product to let them know that flavored products are not allowed in Plymouth. I mean, don't sell something that you know that your customer can't sell.
Right.
You know, start at the very beginning, start at the source. You know, little side note about the cap of the number of licenses we have. We've
Yeah.
now turned away our second person.
So it's ratcheted down. Okay.
Mhm. Yep.
Okay. And
Yep.
that's great. That is an organic way
Yep.
to reduce tobacco and nicotine, all these kinds of
Mhm.
products in the town of Plymouth.
And the
I think
distance that they can't be, you know, so how five, like, is it 500 feet, 500 feet? I forget it off the top of my head, but
right.
they can't be a certain number of feet between two tobacco establishments. That has definitely come into play several times in this office where people have wanted to open shops and stores and things like that. And we just told them you can't sell the product that you want to sell there because someone already exists.
Right.
So the work that you've done is certainly taking a very large spectrum and squishing it a little bit. You know what I mean? Like we're squishing it in. So it's, you know, it is, I'm seeing results, you know, from numbers that caps that we've made.
Right. And I think that, when you think about that from a retailer's perspective, you have a license. As long as you follow the rules, it won't get taken away from you.
That's
And,
right.
and
Yeah.
that's a good thing. And I think as
Mhm.
people exit this areas, I mean, you see large companies exiting tobacco sales for whatever reason.
Right.
It's good for them or good for their corporate image, like the
Any,
CVS
any
just had.
product that's regulated, you know, if you are a store that sells alcohol and you sell to someone who is underage, you stand to lose your license to sell liquor.
Okay.
You know, it's the same thing. You have to be proactive in the product that you're selling to make sure that you're being compliant with laws that have been established.
Right. I want to give, I know we were ahead of our agenda, but I want to give Dr. Reed, Deb, any thoughts, comments, you know, at this point around what we've just kind of went through.
I think you've all done a lot of great work since I've been in one of these meetings. So good job, everybody.
Okay, thank you.
I would say that I agree with what Amy has laid out. I guess the only thing that I might be different, think differently on it is whether, the adult only stores are for adults only. So I guess I sort of feel like, well, if they want to have the higher content of the pouch, that's
But it does still that increases the health risk of it, right? The higher the.
well, it does, but is it any different than putting 3 pouches in your mouth?
Good
I
point.
don't know. It just I could go either way on that one, but overall I agree with Amy.
Yeah, no, my perspective is I think if we're going to start, and I agree with Amy. I think addiction is, it's hard, right? It's a disease, and if you enable addiction, that's bad on us, right? That's a poor decision on us by enabling addiction. Now, there is, there's pros and two sides of the coin here, right? And you could, as Amy even mentioned, you could put 3 in your mouth if you want 18 milligrams. So what is the number? Is it 20? Is it 6? Is it 10? And if you come up with a number, it has to be, in my mind, less arbitrary, right? We got to come up with some science around what is the number that really the sweet spot where addiction is minimized.
But not only addiction, it's cancer causing. So, you know, what's the milligram that would not cause cancer? I don't know.
And I don't think we
These are
know that.
stats we don't know.
I don't think we know that. I
Yeah.
don't think we know, what makes one person become addicted sooner than another person.
Right.
We don't know those things. Yeah.
Just
So
like
those are the things
with
I'm
vaping.
struggling with.
Yeah, like with vaping, we don't even know what the long-term effects of that are gonna be. We really
Right.
don't,
Yeah.
and that's such a scary thing to think about.
So we had those changes, and it doesn't sound like those are material enough. You know, the little verbiage changes, adding nicotine pouches and things to the current regulations. I think the crux of the matter is around the milligrams, right? We really need to unpack that a little bit more and understand that more over time before we act and come up with what we think as a board.
Yeah.
You know, so Madison, any final comments from our student representative on the pouches?
I agree with what everyone was saying. I can see that the nicotine pouches are increasingly becoming like more prominent in schools, like more high schoolers are finding ways to get their hands on them, and it's becoming more of an issue in school since like it's so obvious if someone is like smoking a cigarette or vaping, like you'll see like the smoke, whereas with the nicotine pouch all you have to do is put it in their mouth and no teacher will know, no principal will find out. So they're finding ways to get their nicotine addiction fulfilled and then not getting caught. So it's such a scary thing to be coming so popular now. So I think definitely like finding ways to keep it out of hands of high schoolers would be like a great idea.
Thank you. Amy, last thoughts?
Yeah, I know that there's something with the FDA and the 6 milligrams, and I think it's like I will look that up and I will share it with the board soon. I think I know what it is, but if I say something out loud, I probably will get it wrong. But I definitely know there's something, and I'll share it with the board.
Yeah, and we can, through the process of the board, I think at some point we're gonna make a motion. There's gonna be on something, whatever it is, and we'll fish or cut bait. We'll decide as a board, and we'll do it, you know, uh, with intent. So with that, any new or old business? Our next Board of Health meeting is 10/22, so we'll go from there. Any additional new business from board members? Hearing none, I'd like to entertain a motion to adjourn.
I'll make that motion.
Is there a second?
I'll second.
Okay, a first from Amy Palmer, a second from Deb Zona. Any discussion? No. I will take a vote. Amy Palmer,
Yes.
Dr. Reed,
Yes.
Deb,
Yes.
and myself, yes. Thank you very much for a really good meeting. I appreciate it.